My name is Esaulova. I am from Russia, from Yekaterinburg, and the topic of my lecture is smoking society in Russia and how to help patients who are smoking now. So I begin. The topic of my lecture is evolution of the term, perspective and effectiveness of work of our schools on smoking cessation as a part of formulation of a global strategy for quieting tobacco smoking in society. You know that the topic is very actual because you see that the smoking of Russians is very big. In 2022, it's 33%. And there are a lot of people who don't want to quit smoking, and we must help them. And these people is 31% in 2022. So the purpose of our study was to assess the long-term perspective and effectiveness of our schools as a part of a global strategy for quieting tobacco smoking in our society. We have 97 patients, and the follow-up period is 36 months. Our schools include examinations of our doctors, therapeutics, and other specialists. We have an entrance screening control for laboratory and functional testing. Our patients work with different doctors with the exercise therapy instructions. They work with them face-to-face and online, and we have lectures and practical classes with our patients. So big work were done with our patients. All patients divided into two groups. The first group were the patients with diagnosis of COPD, and the two patients group were the patients without any respiratory symptoms. And these two big groups were divided into subgroups, subgroup A and subgroup B. Subgroup A were the patients who continued to smoking cigarettes, and subgroup B is patients who were transferred to tobacco heart system. So you can see the design of our study. The inclusion criteria were the main and the first, it was established fact of smoking cigarettes for at least 2 years. And the patients must inform consent to go to our schools. We have a primary endpoints and secondary endpoints. The primary endpoints was the main points. We see the efficacy, and it was defined as cessation of cigarette smoking without 6 months. And the secondary endpoints were divided into big groups. The first group, the main indicator was a lung function, the frequency of exacerbation of COPD, a quality of life, and level on exercise tolerance. And in group 2, the main endpoint secondary was established diagnosis of COPD. So I remember that this was the patients who have no any respiratory symptoms at the first visit. The following results we have. The primary endpoints reached in group 1 in 83% at 24 months of observation. In group 2, 72% and 68 months of our observation. And you see on the slide that the group B, 1B and 2B, it was the patients who transferred to tobacco heart system, entered the primary point bigger. The amount of these patients was big because these patients have no symptoms or a little bit suffered from respiratory symptoms. The smoking cessation school without transferring patient to tobacco hatching system. You see, we have a low dropout rate from smoking cigarettes. Why? Because these patients continue smoking, and the results of these who are not transferred were poor. The markers of lack of effective of our schools, it was the non-patients who were dropped out from the program. You see that the total number of dropouts from our program at first year was 52 patients. But in group B, there were no dropouts for the first month. Group B, patients who were transferred to tobacco hatching system. But patients in first group, it was group first A and group 2A, there were dropouts from the program. And you see the results at 6 months and the results during 1 year. So at all, I can say that we see an excellent results in our groups B, 1B and 2B. you see that a decrease of lung function was noted at 1 year of the observation only in 23 of patients. Instead of group 1A, who continued smoking, a decrease of lung function was noted at 48 of patients. You see the difference. And in group 2A, a decrease of lung function and appear of respiratory symptoms was observed at 6 months in 33% of patients. And this group of patients was diagnosed of COPD. You know that the patient who continue to smoke cigarettes, we diagnose the COPD in group where respiratory symptoms are a big amount. And one patient was diagnosed and confirmed the diagnosis of cancer at 2 years from baseline according to X-ray. And in group B, 1 and 2, we see a decrease of lung function in combination with appearance of respiratory symptoms. During 1 year of observation is only 13 of patients. It's a little amount of patients who has appeared as respiratory symptoms. So you see, that in conclusion, I'd like to say that continuous smoking of cigarettes leads to a rapid decrease in lung function, a progressive increase in broncho-obstructive syndrome, an increase in number of exacerbation, and also significantly leads to the development of neoplasm. And the presence of tobacco cessation schools have a positive effect on the health of the population, of the society as a whole. And in group where patients were switching to a tobacco hard system, the effectiveness is higher because we have a big compliance with this group and have a benefits effect on reducing the frequency of respiratory events. So I'd like to say at the end that the smoking cigarettes is a big problem, not in Russia only, in the world whole, and we must work for this problem together. Thank you very much. If you have any questions, I will answer.